Hi everyone and welcome to my channel. My name is Lauren Lucio and I'm a pelvic floor physical therapist. In today's video, I wanted to give you yoga poses that you could use for constipation. First, I'm going to get you to meet me on your mat. So starting flat on your back, we're going to bring our left knee towards the chest. So you're going to think about grasping your hands in front of your shin. I'm going to take an easy inhale breath through my nose. Exhale, thinking about pulling that knee towards your chest. Inhale, relax off it a little bit. Exhale and pull. One more. Inhale and exhale. Now you're going to think about tracing the ceiling with your knee, making circles. Now these can be small circles if you'd like. These can be wide circles. But essentially we're going to do 5 in one direction. So I'm starting with clockwise. And then once you've done 5, you're going to switch the direction of your clock. Now there's no rhythmic breathing here, just making sure that you're taking a moment, you're making sure to breathe, that you're inhaling and you're exhaling. And once you've reached your 5, that foot's going to go back flat onto your mat, and we're going to switch sides. So this time I'm bringing my right knee towards my chest, clasping my hands in front of the shin. I'm going to take an inhale breath. Exhale, pull the knee towards the chest. Inhale. Exhale. Inhale. And exhale. We're going to repeat those 5 circles again on this right side. And switching directions. Bringing that right foot back to the mat. We're going to repeat one more time back on that left. This time I want you to extend that right leg out. So now you should feel a little bit of a stretch in the front part of that right leg. And if that's too much stretch for you, feel free to always bend that knee. We're going to repeat the same thing here on this side. So we're going to take that inhale breath. Exhale, pull the knee close to the chest. Inhale. Exhale. Inhale. And exhale. 5 circles. I'm going to make mine just a little wider this time since I chose to go a little small last time. And then reverse your circle. Placing that left foot down on the ground, we're going to switch legs. So bringing that right back up. I'm going to extend my left leg out. And I'm going to bring my knee towards my chest. Inhale. Exhale and pull. Inhale. And exhale. One more. Inhale. And exhale. And circles. Again, we'll repeat 5 in one direction, 5 to the other. Switching my direction. And bringing that leg down to the mat. So both knees are going to be bent with them facing up towards the ceiling. I'm going to squeeze my legs together. Think about nice tightness and engaging these muscles in the middle. My hands are going to come out into a T position. And I'm going to let my legs fall. This first time, I'm going to go towards my left. So my knees are going to fall down towards my left side. And I can stay looking towards the ceiling. Or maybe I'll rotate my head in the opposite direction that my knees are falling. But this is a spinal twist. And all you're doing here is thinking about taking good breaths, really feeling the body expansion, in this case on the right. Now, if you're the opposite direction of me, that's okay. We're going to always do the opposite side anyways, so stay right where you're at. Now, if you'd like to deepen your twist a little bit, maybe you use your left hand just to place a little bit of weight there at your knees. Again, you don't have to. They're more than great staying here right at your side in the T. Doing 5 more breaths. I like to use my palms to press away from the earth, engage my abs to bring my knees back towards the ceiling. Maybe you reposition, shimmy your hips just a little bit. But now we're going to fall in the opposite direction. So my hands are still out in that T position. My knees and thighs are close together. And now I'm going to drop over towards my right side. And same thing here. I'm just taking nice, good breaths. This time expanding more into that left side body. Now you can do the same thing on this side with that hand. And sometimes also being in a little bit of deeper, bringing those knees a little closer into you, sometimes also feels a little bit more comfortable. And then really encourages you to breathe into that left side of your body. Five more breaths. And again, using those hands to push the earth away from the body, bringing the knees back up towards the ceiling. And just taking a couple normal in through the nose, out through the mouth breaths. Now, rolling on your side, whichever is easier to get up from. We're going to kind of come sideways into that fetal position, using that hand to press up and away. We're going to come to a seated position. So I'm going to give you a couple of cues on the next pose before we get into that. But we're going to do malasana, or what's also known as a deep squat. I really like squatting exercises, and I think they're always good for bowel as well. You can use this in a flow, like what we just did, or you're also able to use a deep squat whenever you get that sensation to have a bowel movement. This is a great position to get down into for maybe about a minute, and then should help your ability to evacuate all the bowel out more efficiently. So how we're going to get there is essentially however is most comfortable for you, right? Maybe you come all the way up to a standing position, or from here in the mat, if you can get down here in kind of this squat position, this is all that we're needing to do. So my hands are going to come together, and I'm going to kind of nestle my elbows right in between my knees so that they're able to kind of provide a little bit of resistance out to really open my hips up. And you're just going to hold this position. Now, if you catch yourself having balance difficulties with this, maybe you're rising a whole lot up on your toes and you feel really wobbly and unstable, tuck a pillow or a towel right underneath those heels to where you're bringing the earth up a little bit higher. Another nice thing to do is using the front of your mat as kind of your ability to stabilize yourself. So this helps versus you kind of like wobbling all over the place here. Okay. So those elbows are in, I'm pressing now, and same thing, I'm just working on my breathing here. So now when I breathe and I take a good inhale breath, right, what I want to think about is really relaxing these pelvic floor muscles. Okay, so nothing is squeezing here at this time. Everything is nice and relaxed because we're trying to allow more of that bowel to come out, right? We want to be able to go to the restroom. So you're just taking a moment here. Again, we're breathing, you're pressing out. I'm giving you all the time because you've been here this whole position, okay? And I'll even catch myself like rocking a little bit from side to side. Again, some of the hip muscles can be a little tight, and this helps to loosen them up too. So you're just taking nice and easy breaths. Give me about 3 more breaths. Now, if you need to stand out of this position, I encourage you to put your hands down first and extend your hips up. Now from here, I can kind of sway, wiggle my legs, kind of get the blood flow back into my legs first before I come up into a standing position. I'm going to kind of work mine out, and then I'm going to come back down into an easy seat. And that's really it. So using those 3 poses, just a quick recap. So we started on our back. We did knee to chest, small circles, both sides. Spinal twist, going left and right, whichever one you'd like to do first. And then going down into a deep squat are all great positions that help move kind of bowel through that intestines. These are great poses to do, again, at any time. They're good for relaxation, even if you don't have constipation issues. These are always great exercises to do and add on to a mobility type of program. As always, I thank y'all for joining me in today. If you have other questions, other issues in terms of your pelvic floor, please check out my other videos. Also like, subscribe, and thanks guys.